I would like to pay great gratitude to the organizers because my presence here as a researcher, I don't treat only as a scientific challenge. I'm father of 3 kids, 3 daughters, so I treat it as an emotional challenge as well, especially speaking about modern technologies and the world that is around us. And the topic I choose for today is the topic that I was working on for last month, which is medical devices driven by the new technologies, especially artificial intelligence. Professor Pawelec mentioned using artificial intelligence in the sphere of jurisprudence. I would like to concentrate on the medical devices sphere. What is important to mention from the beginning is that modern medical technologies refer to advancement like AI-driven medical devices, robotics, gene therapy, wearable devices, and telemedicine. How these technologies impact child healthcare, how they impact diagnostics, treatments, what are the risks, what are the opportunities. From the beginning, we need to mention that this kind of rapid advancement in technology is reshaping pediatric healthcare globally. It's a fact, and it's not the common phrase only associated with Poland, Hungary, but with other countries as well. What are the examples of this kind of medical devices? Please take a look on the screen. There are some examples like smart insulin monitors that they can continuously monitor glucose levels in children with diabetes and provide real-time alerts to parents and other caregivers. Asthma monitors track inhaler usage and environmental triggers to manage asthma more effectively. AI for autism detection assists in diagnosing autism spectrum disorder by analyzing behavioral data and parents or caregiver input. AI-driven pediatric radiology tools help identify fractures, pneumonia, or brain injuries in children's radiological scans with high accuracy, which is really important when you speak about neurology. Other examples like speech therapy assistants use AI to personalize speech therapy exercises for children with language delays or articulation disorders. AI chatbots, not only GPT, but AI chatbots for child health, like provide information to parents about symptoms, medication, and wellness for children. And therapeutic robots. The most popular is Moxie. Please look at the internet, click Moxie, and you will see what the Moxie is able to do. Provide social interaction and emotional support for children undergoing treatment. Very popular in Japan and South Korea. What are the opportunities in child healthcare? Benefits of using AI-powered medical devices are, like you see, there are only some examples. More efficient diagnosis. Accurate diagnosis requires careful analysis of complex patient information. Artificial intelligence algorithms can quickly process all data from around the world. Secondly, greater chance of detecting a rare or unusual health condition of a patient. Even the most trained doctor, even experienced doctor, is only a human being and may be not able to recognize a rare health condition of a patient. Diagnostics results through AI can be compared with the results of millions of other patients. Thirdly, the ability to warn of an impending critical condition. Thanks to continuous monitoring, there is a chance to identify the danger in advance. And the fourth, better access to advanced remote care, the ability to provide quality healthcare to patients who are outside the facility, outside the big cities, outside the hospital. We are talking not only about video conferencing, but the use of medical technology integrated with AI functionality. But there are not only opportunities, but risks as well. And usually when we speak about AI and we think about children, we should be aware especially about those risks. And what those risks are: over-reliance on technology, reduction in critical human skills in healthcare, misdiagnosis due to unchecked reliance on AI outputs, accessibility divide. So we can have those parents who have access to AI medical devices and those who this kind of access don't have. Psychological effects. Overuse of health monitoring devices may increase anxiety in children and parents. Please go back to this MOXIE and think what is the difference between having MOXIE in the hospital or the hand of your parents. And the fourth, long-term unknowns. Potential long-term effects of medical devices powered by AI. And some facts, some figures. Europe ranks second after the United States market in the global pediatric healthcare, despite the fact that this market was valued approximately 12 million American dollars in 2018. It is projected to be almost 16 billion by the end of this year. But what is important, that the medical device sector has been dominated by the development of products only for adults, not for kids. And the most commonly cited reasons for the lower interest of manufacturers in pediatric medical devices include engineering challenges. It is really usually more difficult to produce something which is smaller, something which needs more attention. So smaller size requires greater precision. Identical regulations for medical devices for children and for adults. In the European Union, we have MDR regulation, which doesn't differentiate between medical devices for adults and for children. And lack of financial incentives from payers. Kids don't vote. What about access to pediatric medical devices, in the European Union especially? There are very few medical devices available on the market that are specifically designed for children. Devices intended for adults are often adapted and used off-label in pediatric care. So we use medical device designed for adult and we use it for the children or for the children purposes. Pediatricians and pediatric surgeons, acting as usually in the best interest of children, of patients, take risks by modifying devices for adult patients in a way that meets children's needs. But children are not smaller version of adults. The Professor Malarewicz Jakubów in her book about children as a patient, mentioned, a child is a human being who demands appropriate conditions for their full development. A child is a being with particular needs and therefore requires treatment from adults that meets those needs. So medical devices intended for adults and used in children often lack confirmation that they are safe for the youngest patients. Medical devices that require active participation from the patient may be usually beyond the capability of a child. Therefore, there is no separate regulation and no separate certification system for medical devices intended for children only. So what has to be done immediately? From my perspective, the producers are waiting for the new set of regulation, for the regulation that will give the better access to medical devices, especially for children, and especially for the medical devices driven by new technology, especially AI. We have something similar. When we speak about medicinal products, we have special regulation like orphan medicinal regulation. The system for medicinal products is regulated by the regulation of the European Parliament and the Council, which concentrate on the medicinal products called orphan medicinal products for children, pediatric orphan medicinal products. There is no similar regulation that specifically address medical devices used in pediatrics. But please take a look. In the United States, medical devices for children are an important part of the market. The US Food and Drug Administration has issued many guidelines in recent years concerning the pediatric evaluation of medical devices. And there are only some examples of those documents that concentrate on the medical devices, especially designed for children. So what more we should and could done together? What is needed? First of all, dedicated regulation for pediatric medical devices, like this regulation, and I mentioned already, orphan medicinal products. Strict data protection laws for minors, continuous monitoring technology used in pediatrics, long-term studies on effects and efficiency of new treatments, combining human expertise with AI for enhanced outcomes, and making new tech accessible for everyone. But the priority should be, of course, taken to the legislative work, and we need special regulation concerning pediatric medical devices. I mentioned this regulation, MDR regulation, and it has to be emphasized that last year the European Pediatric Association said that there are less and less medical devices for kids in Europe because this MDR regulation puts the level of the entrance to the European market on the very high level. So we should do something immediately if we still need to, if we still want to have medical devices in Europe accessible for everyone. And I think that there is a place here to say that we can work together, Poland and Hungary, for a better and healthier future of our children. And this is my wish for the new year 2025. Thank you for your patience.